Unemployed doctors in KwaZulu-Natal are staging a sit-in outside the Premier's office in Pietermaritzburg over vacant posts in the healthcare sector. Today marks their third protest since January, highlighting their struggle to find jobs and the broader crisis in the sector. Newzroom Afrika's Silethiwe Ndlovu is tracking the story. She joins us live with the latest. Silethiwe, in the last hour, you spoke to one of the doctors protesting outside there. Who is going to be meeting, if anyone, meeting and engaging with those who are protesting at the Premier's office?
Well, Michelle, they do hope that the Premier is going to show up at some point. We are, of course, outside the Premier's office, but I'm told that in the past they have raised concerns, and it seems as if they've spoken once or twice to the MEC of Health, but we're told that the last time they had a conversation with the MEC of Health in the province was around March. But perhaps let's get more insight in terms of the progress that has been made or progress that has been said to them over the past few months. I want to start off by talking about the broader crisis when you are looking at the healthcare system that we have here in the province of KZN.
Yes, so it is terrible what is happening. I think you would know the case of a young man in Prince Msheni Hospital who passed away on duty because he was not allowed to take a sick leave. And that is an intern. That is a person who is in training. So he shouldn't have to be, the system shouldn't have to be relying so heavily on him that they can't allow him to go off. We are the people who have done 6 years of medical school. We have done 3 years of training. We are fully qualified doctors. We are the people that should have been working there and handling the pressure of patients coming in. So the problem is even broader because patients they wait long times in queues, and sometimes we even turn them away. Because in my 3 years of experience, many times I've had to come out to patients while they are on a line at 4 p.m., 4:30, and tell them and ask them to come back tomorrow. You don't know how long they've been waiting in that queue. You don't know how sick they are. We try to triage and prioritize those who are very sick. But the problem is dire, especially when it comes to now patients who need operations and all of those things. So it takes a long time for people to get operations and all of those procedures.
I want you to talk to me about the conversation that you've had with the MEC of Health or even with the Premier. What is the information that has been shared by them, particularly when you're looking at reasons why you remain unemployed? This is now post your community service.
Maybe just to give a background, we started this protest as early as January, in engaging them via emails and other forms. And we did the first protest. We went and then we stopped because of they told us the problems with the budget, which we understood because there were problems with the budget. And then we came back in March, and in March they also they met with us now in March. The HOD, we were expecting a meeting with the MEC. But only to find when we get into the boardroom, only the HOD is there. The MEC is nowhere to be found. We have not met with the MEC since we started this thing, which is really, we ask ourselves, what is really the reason? Because we see her going to rallies, we see her having podcasts, and also everywhere except giving us time to meet with us. And we waited for her for weeks. In any case, so we met with the HOD. In that meeting, they promised to continue engagements with us. On a weekly basis, they promised to meet with us, to engage with us. And they promised a meeting on the 18th of April, which never materialized. And a lot of other promises were made that never materialized. So as we stand right now, from the department, there's nothing concrete that they've given us to say employment is coming. And the budget is there. The need is there. The vacancies are there. So we wonder what is the holdup.
What do you think is the holdup? You're mentioning that the budget is there, KZN currently being the only province yet to advertise those posts. What do you think is the issue? Could it possibly be a provincial government issue? I mean, you're mentioning how basically the calls that you've made have fallen on deaf ears. What do you think is the issue?
At this moment, unfortunately, we can only speculate because, as I've said, they've not engaged with us in a meaningful way. So we don't know really what issues they are facing. But we do know that the province is under a lot of strain financially. We've seen service providers also protesting here with the PSA right at these gates for payments of overdue payments on services that they've rendered. So there's an inkling that the province is facing financial difficulties, but they're not talking to us. And the problem is that allocation has been made outside of the budget of the Department of Health for the employment of doctors. So really, we don't know what's the hold up on that.
Okay, thank you so much for speaking to us this afternoon. That's Dr. Zagwe, Michelle, basically highlighting some of the issues that they faced with. And he does state that there was a meeting that was actually supposed to happen sometime in April. It seems as if it never happened. And at this point, they are still waiting to get answers in terms of why those posts, particularly in the province of KZN, are yet to be advertised. And this is now despite the budget being allocated.
Silethiwe and Ndlovu with the latest there from that sit-in by unemployed doctors in Pietermaritzburg.